Hello, good morning. I'm Dr. Louis Chen. I'm from KBJ Ipoh Specialist Hospital. I'm the consultant ear, nose, throat, head and neck surgeon. I've been practicing in the ENT field for the past 14 years. Sinus infection is the inflammations and most of the time it's germs infections of the sinus lining. But a lot of time, public will not understand what is sinus. All the public know is this triangle, nose, that's all. But actually, the nose is not simply as a triangle. There is a lot of empty spaces around here, below your eye, and empty spaces in between the eye, and empty spaces above the eye. This is called sinus. And the sinus cavity is supposed to fill up with air. And every day, when you breathe in and breathe out, the air will go into this area. And these areas will constantly produce mucus-like secretions that constantly flowing out towards their natural passage to the nose and back from the nose to the back of the throat and swallow down. Sometimes this flow is so slow that none of us will be aware of it. Just like every one of us here. Actually, each day, this sinus lining produces 500 mL of mucus every day. Just imagine this half liter, but we didn't aware of it. When we aware of it, is when there is increased productions. For example, having a flu, where the virus attack this sinus cavity, and it produces a lot of excessive amount of mucus that you're aware that your nose is running. There's a lot of mucus backflow to the throat. Now, sinus infections a lot of time been mistaken by public as flu. Some of my patients will say, I'm having a flu almost every day for the past 10 years. Well, flu is a viral infection, and viral infections is supposed to settle within 7 days to 2 weeks. Even if with a secondary bacterial infections, it will settle with a simple antibiotics. But if your problem is persist more than 7 days to 14 days, this is definitely not flu. So if you have flu every day or most of the weeks throughout the years, please consider sinus problem. And in the nose, there's a lot of disease, yeah? But all these disease will come with the same problem. Blocked nose, running nose, sneezing, loss of smell. So which one is sinus? Yeah. So there's a few key features of sinus infections. Number one, you may have loss of smell because nerve of smell is on the top or the roof of the nose. Number two, you may have bad smell in the nose. Some of my patients will say it's like the smell of a dead rat or a fishy smell. This typically is germs infections of the sinus. And of course, another one is a post-nasal drip. Post-nasal drips is something like I do it now. Backflow. This backflow, if it's persistent, it can become a features of sinus problem. Yeah. So these are the few key features. And of course, headache. Most of the time, headache of sinus in origin will be around the area where I explained just now. And what we found during the examinations, when we put in the little scopes, and the scopes will see pus flowing out. You may see some clear-cut issues of swelling, pain, redness, and pus flow.